Welcome, everyone, to the Best of Markham podcast, brought to you by me, Igor Klibanov from Fitness Solutions Plus.ca, your personal trainers for chronic conditions. Here with me today are doctors Wendy Zhou and David Tam from HealthyToDos. Guys, thank you so much for being here. Tell us about yourself.
Thank you for having us,
Thank,
Igor. Go ahead, you can
thank
go,
you.
Dr. Wendy.
Yeah, so um, I'm gonna start. My name is Dr. Wendy. I'm from Healthy To Do's, and I would say that one of the things that inspired us to actually start Healthy To Do's is that we were working in multiple integrative clinics across Toronto, and we just find that we're not getting that integrative into things for health clinics. They can call themselves integrative, but sometimes like the from a patient's perspective, they're still not truly integrative. So Dr. David and I kind of like sat down and really talked about what it means to us to be integrative clinic. How does a client of ours, for example, or a patient of ours who sees both myself as a naturopathic doctor or him as a chiropractic, how do we actually integrate the two um, professions in a really seamless way so that it's not a burden to the patient? Because we find that for our patients, they are often repeating the same things, the same health histories twice, they have to go through initials twice, all that type of things where we can actually mitigate a lot by just talking behind the scenes a little bit.
Yeah.
So we find that we were working in integrative clinics, but we're not truly integrative in that sort of way. Nobody's talking behind the scenes. People are still working as independent contractors. So we build healthy to-dos in a way that we can fill the holes in the society, right? So we're there to support practitioners so that they can talk amongst themselves in order to give the best care for our clients, as well as fill in the holes that created by our current healthcare systems where there's lack of access, so that we are able to fill in that gap for those patients. Last but not least, we want to create a supportive environment for our patients as well, because oftentimes we hear patients go like, hey, you need to, or sorry, the doctors are like, you need to lose some weight, you need to do this. The patient's like, okay, but then they go home and they go like, what's the first step to start
Yeah.
losing weight, right? What are some of the steps I need to do in order to get to the goals my doctor set for me? Because they just gave you one sentence. So we're here as a dream, like for Healthy To Do's, to also bridge that gap a little bit so that we can give you step-by-step directions so that you can create a healthier yourself, pretty much.
Yeah. No, that's very helpful because I mean, obviously I run a personal training company with a specialty in chronic conditions. So I know when my clients have a health day, they see one chiropractor, they go to a different clinic, they see a naturopathic doctor, they go to a different clinic, they see a massage therapist, and they go to a different clinic, they see like an acupuncturist. And there's no like one central like concierge to have like a team huddle. But if everybody
Mhm.
here is in the same clinic, it's truly integrative. And when I have looked at other integrative clinics in the past, the only integrative thing about them is that there are all these separate practitioners working, but they're not talking to each other. You're absolutely right. So that's a very, very unique concept. So fantastic for starting it up. David, anything else to add to that?
Yeah, just to kind of repeat a little bit similar to what Dr. Wendy was saying, is in the past we've worked in multidisciplinary clinics. However, a lot of practitioners kind of work in individual silos. So our goal here really is to provide that collaborative care within our team where we want to take the stress away from the patient itself, right? We want to be the person that spearheads, that guides the client itself so that they can really focus on their health, their wellness goals, and really focusing on becoming a healthier them at the end of the day, right? So that's where Healthy To Do is originally evolved from, and we provide multidisciplinary integrative care so that we are able to streamline everything behind the scenes and make it easier on the client more than anything else.
Yeah, that's fantastic. And Wendy, how'd you get into naturopathic medicine and David into chiropractic?
So I'll start first. So for naturopathic medicine, I think that it happened while I was actually in school, and I was trying to determine what to do. One of the things I noticed about my parents, and I think that many people might actually relate to this, is that they are very against allopathic medicine, not in the way of like concept, but the way of taking medication,
Mhm.
taking drugs, taking medication, and having to rely on that drug and medication for the rest of their lives. So I start looking into other ways because I know from my background that there are other ways that other countries has actually dealt with health and medication in that sort of way. And I was looking at professions that may possibly give me that same idea. So now that I stumbled across naturopathic medicine, we're kind of like, um, you can say family doctor in a way, we look at everything, but we give you other options other than medications, right? So we're looking at diet, we're looking at lifestyle, and this kind of speak to my parents and the way that they like health or they define health to be.
Yeah.
So now that inspired me to go down that path, and now I help other people, not just my parents, but helping other people to that has similar ideas trying to achieve their health through other ways so that they're more in control and they're not losing control or giving control by having to take a medication for the rest of their lives.
Yeah, yeah, and I'm very much on board with that approach. Obviously, the books that I write, the subtitle is always how to improve whatever condition, like in reverse diabetes, reverse osteoporosis, and after that, without medications. Because you're absolutely right. Like I have no philosophical issues with medications, but from a practical level, I mean, you take a medication, some side effects come along with it. Now, not everybody
Mhm.
experiences side effects, but you don't know ahead of time before you take them, are you going to be in the category that, in the group of people that get side effects or doesn't get side effects. Whereas the safety profile for things like nutritional changes is way better. Exercise, supplements, much, much, much better safety profiles. Um, Now, of course, there's a time and a place for medications, but generally speaking, the more side effects, the potential for the medication, the further down the priority list it should be.
I usually tell my patients that there's like you said, there's a time and place for medication, and there's a time and place where you can do something,
Yeah.
right? So by giving people options, and that's what I notice a lot about my patients, is that they feel like they have no other options other than taking that pill in
Yeah.
order to solve their problem. By giving them options, they're able to feel more in control of their health. And that's exactly what it is giving back that control or giving back that feeling like you can do something about your health other than just that's the only option available for
Yeah,
you.
absolutely. I mean, like I tell my clients all the time, every approach you take has a cost benefit and it's like a ratio, right? You take a medication, there's a benefit to it, which is it's going to do what it's supposed to do. Let's say you're taking metformin, it's probably going to sensitize you to insulin, it's going to lower your blood sugar, but there may or may not be side effects. That's got an excellent safety profile. But you take something like Ozempic, way more side effects, right? Um, on the other hand, there's also a cost benefit to exercise, which is, as a personal trainer, that's my domain. The benefit, of course, is you can also reverse diabetes with exercise and osteoporosis, etc. Um, but there's also a drawback to exercise, and that's time. It takes way more time to complete a workout than to take a pill. And if somebody's going to hire a personal trainer, that cost is not just time, it's also money. So everything has a cost benefit. It's just what are you comfortable with? But it's nice to know
Exactly.
many different options and not just one. Yeah. And David, how'd you get into chiropractic?
Yeah, so similar to yourself, we're with all the movement aspect of it, and you're basically hitting the nail on the head with everything there. I've always been passionate in the field of health and movement growing up. So for me, I started off as a personal trainer shortly after starting university, where I studied a Bachelor of Science with a focus on movement and kinesiology.
Mhm.
So this interest was further reinforced during my co-op term when I was working in retirement living, when working with an elderly woman that fell and fractured her hip. So she came to us for 4 months of rehab. For her, it was more than just regaining the ability to walk. Really was just regaining her autonomy and her confidence to perform day-to-day tasks. So for that, it really sparked my interest in further pursuing a postgraduate degree in the Doctor of Chiropractic at CMCC, just so that we can further develop the tool sets and the assessment abilities to help people reach their goals from there.
Yeah, that's awesome. And Wendy, what do you like most about being a naturopath?
I think that one of the things I enjoy about being a naturopath is like really building a plan for people, step-by-step plan for people, and see that they are improving. And one of the things I often say to patients is that the plan that I give them can get them from 0 to 100%, but it doesn't mean that everyone is going to get to that 100%. And even if people did half of what I told them to do,
Yeah,
then they're 50% better than where they actually started. And that's still a win, even though that they didn't complete, say, for example, exercise 3 times a week, like we discussed, they only did once a week, but it's better than if they didn't do anything at all. So seeing people actually improve as they go through the plan is actually very like satisfying, right? And also being a clinic owner, kind of like segue into a different role is that we can see that we're building something out of nothing in sort of in a way that kind of like is exciting because you're out in the driver's seat and you can drive this idea, this unique business idea anywhere that you kind of want. And that's kind of like very exciting compared to just being a clinician as well.
Oh yeah, yeah. See, I was actually going to ask you, but both of you, you're not just a naturopath and a chiropractor. You also, well, clinic director. So you're essentially entrepreneurs. So we'll chat about that in a sec. My favorite part, the entrepreneurship side of things. And David, what's your favorite part about being a chiropractor?
Likewise, it's the same thing. It's being able to have the professional abilities to assess, diagnose, and treatment plan various conditions that come in here, right? So for us, at the end of the day, it really is helping our clients and patients reach their goals that they need, right? Whether it's picking up their grandchildren, whether it's returning back to pickleball, badminton, and etc. For us, it's really treatment planning, getting them from point A to point B in a seamless fashion. And the great thing about this is we always have the clinical skills to back up, but we also have that ability to expand beyond one-on-one care. And that's where the entrepreneurial side comes in for us.
Yeah. Yeah. I mean, I totally get how fun it is to be an entrepreneur because I was just a personal trainer in a community center and a country club. I started my own business and it was exciting, very scary, by the way, but also exciting to test out new strategies, thinking which one is gonna hit. So what do you guys like most about being entrepreneurs, clinic directors?
To be honest, I think it's a dreaming aspect of it. Like, what could the clinic possibly be? What type of patients? How can we help the patients even more than what we can offer right now? Right? What is feasible? Who do we want to hire onto the team that can even make bridge that gap even more? So one of the goals that we have as Healthy To Do's is to be able to bridge the gaps that we currently see in the conventional care system, the things that the patients come in and they go like, I wish I had, right? So how do we address that I wish I had? And not just that, it's also like as a practitioner, we are limited in terms of what we can do. There sometimes when we've been practicing for a while, we hit that limit of like this is what you can do as a naturopath, this is what you can do as a chiropractor. Now, how do we offer the services that's beyond what our scope of practice can do by adding another team member onto that team. For me, that is amazing in a way that we can holistically give a seamless treatment plan to a patient rather than having them to have to bounce back to their family doctor, get a note, get a
Yeah.
assessment, get an imaging, and then come back to me and all that type of things. We kind of eliminate that by having, for example, on our team, we have a nurse practitioner that builds OHIP directly that can actually be able to have access to things that is outside the scope of normally what naturopathic doctors have and what chiropractors have.
Yeah. Yeah, I've actually seen that as well, where it's a model that starts off with just naturopathic medicine, but expands to things like nurse practitioners. I asked one of the other interviewees here, one of your former, not I guess classmates, but she graduated before you, Sophia Ma. And in her clinic, they also have a nurse practitioner because I was asking her about testosterone replacement therapy.
Yeah.
Because NDs are not allowed, but a nurse practitioner can. Um, so absolutely a great idea, A, from the perspective of client experience or patient experience, that they don't have to go to a bunch of different practitioners, and B, good for profit. More money spent within your clinic. So it's everybody benefits all around. Um, awesome. And David, what about you? What's your favorite part of being a clinic director?
Yeah, for sure. And I was listening to that podcast where you were interviewing Sophia Ma from Silver Spruce and a couple other podcasts as well too. The favorite part for me is it really is creating something out of nothing, materializing that. So for us originally, Healthy To Do's was a wellness blog page on Instagram, right? So through that, it was really just showcasing different types of healthy lifestyles, healthy things to do, hence our name Healthy To Do's, right? Through that, what we did was we have evolved it into a clinic, and it really was just concepts, concepts, concepts. We were able to create an idea, run with it, and then materialize it into something physical and eventually into a business. So for us, it's the vision and the creation that is what excites me the most. Together with all the other things, together with business ownership, learning the different things along with marketing, all the other skill sets that are just beyond pure clinical care is what excites me the most, is that it really rounds you out as a practitioner, but also something much bigger than that too, and really allows you to grow a team to really support what you need to get done to help people create a healthier them.
Yeah. Yeah, it sounds like a very patient-centered clinic. And you guys have both mentioned when I ask you about who's your favorite part about being a clinic director is dreaming and thinking about what could be. So speaking of which, what are you guys working on right now that's exciting to you?
Yeah, I'll start. So on the health side, we sometimes break our teams into health team and the rehab team. So on the health side, one of the things that we've been doing is last year we brought in IV iron. We have the nurse practitioner who's very, very versed in doing IVs because she was a postpartum nurse doing a lot of IVs in the hospital in Markham before she came and worked with us. And she was doing a lot of IV irons for patients who fail out of the OHIP system. So OHIP does actually do a IV iron. However, you have to meet a certain standard. Now, as a naturopath, we see a lot of patients who have symptoms of low iron or being anemic. However, they don't hit that OHIP, very strict OHIP cutoff line. So they need, even if they had money at that point, they couldn't get an IV iron. So now we kind of like bridge that gap by offering IV iron with our nurse practitioner. And now this year, we're expanding it to be a delegation to a naturopath as well. So for people who wants to use their naturopathic benefits, but they can't afford full on IV iron with our nurse practitioner, it's possible to do it with a with a naturopathic doctor now as well in our clinic. So that's something new in our clinic this year. The second thing that we're working on is that we got our pelvic floor therapist like certification. So there's a lot of pelvic floor physios that you hear outside, and we're not trying to replace them. When I say we as a naturopath, we're not trying to replace them. But with the pelvic floor certification, we can help, especially the menopausal women, a little bit better because we combine what our scope of practice can have, which is blood work as well as bioidentical hormones. But we're also combining with training of that pelvic muscles, understanding where people are, and also we combine that with like my backgrounds in cancer preventative health as well as chronic disease preventative health, similar to you, Igor, where a lot of patients who have had past breast cancer history or cervical cancer history and all that type of things, where they may have already had a hysterectomy, what does that pelvic floor actually is doing for them? So having that conversation with integrative from a naturopathic standpoint who understand pelvic floor is actually very important. I just want to stress that pelvic floor training is not a normal part of naturopathic trainings, like when we're in school, and neither is it in physio. We have to take additional courses, additional trainings in
Mhm.
order to obtain that knowledge and certification to be able to do that. So those are all exciting things that we are trying to bridge that gap. Again, it comes back to that unique perspective in healthcare that we're trying to create so that our patients are not running into pelvic floor physiotherapist and naturopath and their medical doctor and all that type of things in order to receive the same level of care.
Yeah, yeah, and I am wholeheartedly on board with that because like as a personal trainer, my client's number one goal is most often fat loss. Now, personal trainers, they can't talk about nutrition as part of their scope of practice. All they can say is Canada's food guide, which, if people ate like Canada's food guide, they would be way better off than the standard American diet or standard Canadian diet. So that's already a step in the right direction. But then what about clinical nutrition? What about if they have osteoporosis? What if they have diabetes, etc.? So then I'm like, well, Mike, I'm referring out to dietitians, but um, I don't know any dietitians at the time, and my client then has to research, go on Google, and see what's a good dietitian, and then make the appointment, pay the money, etc. So I was thinking, why don't I get certified in this stuff, and then I'll provide them. So it's a one-stop shop. Um, that this way I can offer more comprehensive services, but B, because they're following my guidelines, I can reinforce compliance to those guidelines and help on the extra side of things as well. Which again, to me, is the same thing as exciting, just as exciting as to you, that the patient has better compliance and better results because they're doing more stuff. Um,
And also, they already trust you, right? They trust you because that's why they're coming in to see you,
yeah,
right? And same thing at Healthy To Do's, they already trust us. If we're able to kind of like speak about a level of understanding that other people may or may not have, then it's great. Even if we have the same, like I always tell people that I don't replace pelvic floor physiotherapists.
yeah,
I do not, right? But I can assess the same way I understand it, and I refer out to pelvic floor physios when they
yeah,
need that training of that muscles, right? And that's what physio is. It's rehab. However, if you go to a pelvic floor physio, they cannot, similarly in Ontario, they cannot speak about diet.
yeah.
However, a lot of people, when they integrate it, they have a higher chance of improving from their perspective.
Yeah.
Hmm.
It's sometimes it's just the simplest, stupidest things that improve compliance. For example,
Hmm.
when I tell my client, you go see a pharmacist, they'll say, okay, I'll do that. But then I ask them next session, did you see a pharmacist? No. But do they have one that they know? Yes. So why didn't you do it? It just didn't schedule it. So during my sessions, I start, okay, are you going to see a pharmacist? Yes. All right. When? Okay, at 10 o'clock. And what are you going to be doing right before you're going to see them? I'm going to be at home. And so what route are you going to take to see them? So I make them create a picture in their mind of how this is going to happen, even though it's extremely simple. It's elementary. But if you take the small block like obstacles out of the way, then it's much easier to create behavior change instead of just here's advice. I'm a smart person. Here's advice you can't implement and you're not going to implement. But
Yeah.
you really want the patient to get results.
Yeah, to get rid of like those small like blocks, right? The obstacles. So similarly, we tell people to kind of like put your gym shoes out there and your clothing all in the gym bag so that you can actually get up in the morning, just grab and go
Yep.
so that you don't miss a gym, right? So similarly to that. Yeah, exactly.
Take willpower out of the picture.
Exactly.
And David, what's exciting to you? I mean, Wendy mentioned a lot of cool stuff. I'm sure you're probably excited about all the same stuff. Is there anything else, or you're basically all the same?
No, there's a lot. So going back at the end of the day, there's so many different things that clients need to focus on, right? So for me, what my focus on is really trying to pivot beyond one-on-one care, right? Utilizing different mediums, social media, whether it's group programs online, different mediums to kind of launch ways to deliver to a larger audience, right? So whether it's managing arthritis, right? Whether it's maybe speaking a little bit about specific nutrition aspect of it, right? That's something that we're working on behind the scenes, whether it's through social media posts and finding different ways to educate people and really just getting freebies from us more than anything so that they're able to make informed decisions. And if they need, they can consult us and we can provide our professional help as well so that it goes beyond just utilizing our time on a one-on-one basis is what I'm working on.
Yeah, yeah, that's awesome. And you guys are both part of the Markham Small Business Starter Company programs or Starter
Mhm.
Company. How did that go for you guys? Oh, actually, before we talk about how did that go, for listeners and viewers who don't know what that is, let's just explain it first.
Yes, for sure. So for me, it was wonderful. I was the one that mostly dealt with this one. So the team at the Markham Small Business Center over there, Serena, Stefan, Anthony, right? They were really, really insightful with helping small businesses like us. For me, the focus for the business was really launching more of a digital marketing strategy,
Yeah.
really improving
Let
the.
me take a quick break.
Go
Let
ahead.
just to viewers and listeners who don't know what Startup Company Plus is, let me explain. Startup Company Plus is a government program where they give entrepreneurs both a grant, I think it's either $3,000 or $5,000, in addition to 12 weeks worth of mentorship about marketing, sales, operations, stuff like that. Um, so that's Startup Company Plus. Go, continue.
Yes. So it was really good in terms of it was a 12-week program. We were able to kind of have some mentorship, especially with people that are outside of the chiropractic industry. So they're marketing experts in various sites, and they were able to provide insight from a different lens, which is so important, especially as a small business owner that is in the healthcare sector. You oftentimes get really immersed in your own world, and having a different perspective from somebody else outside is really important. Through that, I was able to work with the different mentors on a pretty regular basis, and we were able to establish a digital marketing plan on what we need to do. What are some things on creating, say, like a content schedule so that we can launch our social media on a very regular automated way. So as a business owner, I'm no longer bogged down with just chasing posts after post after post. We're able to plan a month ahead and we're able to schedule everything out, right? So that's really important. And it's one of those things where, as a chiropractor, it's a very different way for us to think. And we're thinking more and more like a business owner there.
Yeah, yeah. And I've noticed that a lot. Wendy, no offense, but naturopaths are very much unlike you, and that's good for you because naturopaths are not very business minded. So for you to be a clinic director and entrepreneur is not common amongst naturopaths. With chiropractic, I see way more chiropractors that are business minded, but still not as many as who are clinic directors. So yeah, it's you got to put on your naturopath or your chiropractor hat, but you also got to put on your entrepreneur hat. And to the viewers, to the listeners, full disclosure, I am a mentor, a volunteer mentor for the Markham Small Business Center for the Startup Company program. I didn't mentor Wendy or David specifically. Our schedules never aligned. Um, but it's very interesting to me to hear what our other entrepreneurs doing for marketing. And you're absolutely right. I think the greatest benefit you can get from that kind of mentorship is ideas from other fields. Because for me, as let's call me an unconventional personal trainer, all of my best marketing strategies came from outside of personal training. For instance, if you ask most personal trainers, what's your marketing like? First of all, they'll say, huh? What do you mean marketing? I just get clients. But if you press them on it, they'll say two things. One, referrals, and two, social media. If you press them on that, you'll ask, is there anything deliberate you do to generate referrals? They say, no, they just happen. Translation, I have no strategy. I hope for somebody to do something which is not predictable, it's not proactive, etc. Two, social media. If you press them on that, I once did. I asked a personal trainer, how many clients did you get through social media? He says, a lot. I said, how many? He said, 10. I said, okay, over what period of time? He said, 3 years. I said, hold on. You got three clients per year on social media, and how much time did you spend on social media? He says about an hour a day. So you spent 365 hours to get three clients? That is horrible. I didn't say that part to him. Um, but but I'm thinking there's way better ways to do things. So what other personal trainers do, I don't do. I want to do stuff that's not common in my field. So for me, my four most effective strategies is one, public speaking, two, email marketing, three, writing books, and four, surprisingly, door-to-door sales. Um, and none of those are standard in personal training. So that's where I really like the mentorship and also talking to other entrepreneurs because what might be very common in their industry is completely outside of my industry, which could have very large effects. Um, so yeah, very, very exciting stuff. And I'm glad you benefited from the Startup Company Plus program. Now, entrepreneurship is not just, sunshine, lollipops, and rainbows. There's also obstacles that come along. So what obstacles have you guys encountered in your time, not just as, as the technicians, but as entrepreneurs and clinic directors?
Okay, so one of the things that I think the toughest for me is to be able to shift between naturopathic or being a doctor to being a clinic owner, as well as being the bookkeeper, being the a person who managed like inventory in and out and all that type of thing. So for us, it's kind of like learning how to wear different hats when those hats are needed, and that shifts, like, it may sound really easy for some people, but it is actually not very easy for us because we're not taught how to be business owners in school. In school, we're taught how to be a wonderful doctors that doesn't, hurt people, but we help people, but we're not taught how to market. We're not taught how to bookkeep. We're not taught how to, what is a successful business. And unlike the conventional doctors where patients just kind of flow in, we're set with the same standard as conventional doctors, marketing standard, but we don't have the same demand as a conventional doctors, right? So we have to find a different way to market that doesn't break the marketing standards or that our colleges actually impose on us. So that's kind of like one of the difficulties that we do actually find, including Google. Google ads and stuff like that impose a lot of like things about marketing for health and health-based stuff. We're trying to find ways around it in order to be able to successfully appeal to our audience so that they know that we exist. And that's the hardest part is that we're allowed to market that we exist, but we're not allowed to really kind of like tell people what we do, why we are able to help them and stuff like that, except for like things like this, like podcasts and stuff like that. That is definitely helpful, where we can actually open and speak openly about things, but that's not always the case behind the scenes. So different hats, that's very difficult.
Yeah, I totally get it. When I speak to naturopathic doctors about what they can and can't do in their marketing, I'm like, Kono really wants to commit like naturopath suicide in Ontario. Because when I speak to students who are actively in CCNM, I ask them, what do you want to do after you graduate? A bunch want to stay in Ontario, but also a huge bunch go to the US or BC because the marketing is so much easier in those places. Like the basic standards of good marketing can is not allowed to be done by naturopaths in Ontario. Can't sell packages, can't sell can't do testimonials. Like there's a lot of stuff you guys can't do. So I that's a very real challenge. And part of the fun of entrepreneurship is figuring out how to overcome it. And what about you, David? What kind of challenges have you experienced as a as an entrepreneur, a clinic director?
Yeah, for sure. And especially with the clinic being so multidisciplinary, because we have Dr. Wendy as a naturopath and some of the restrictions that you talked about earlier as well, too, right? And likewise for my chiropractic practice and also registered massage therapy practice, we have slightly different advertising standards as well, too. So as a clinic director, we need to really think of the clinic's overall holistic health and what we are allowed to do without essentially breaking some of these advertising standards, right? That was one of the biggest things that was a little bit more of a challenge, I would say. And also going back, wearing multiple different hats, right? On one day, you might be coming off of treating a patient, then you're switching over to, say, bookkeeping or switching over to marketing aspect of it, right? Or sometimes when last minute things arise, maybe you might become the custodian for the clinic or you might
Yeah.
be the handyman, right? So all these different things, it's really having to learn on the job, right? And chiropractic school is great. It teaches you a lot of things, but it does not teach you all these quick shifts that you have to make. And there are days where you come home and you're figuring out the next steps, right? So there are days where you work really night just to see if you can kind of go and troubleshoot what arises at the clinic. And it's a lot of it's just problem solving while we're still figuring things out for the first 2 years right now, right? So,
Yeah. Yeah, I'm kind of in the same boat as you. Like I graduated from kinesiology. In kinesiology, they teach anatomy, physiology, biomechanics, statistics, but they don't teach business, marketing, stuff like that, which is fair enough because most kinesiology grads either go into chiropractic college, naturopathic college, gym teachers, physiotherapy, stuff like that. Very, very few kinesiology grads become entrepreneurs. So I understand why they don't teach it. But it would have been nice to at least have an elective of
mhm,
how to run a small business. There was a course back when I went in business management, but that's like, what if you work for a big, sports company and you
mhm,
work with it? It's a corporate job, not small business. But that
right.
would be a very, very interesting course to take if I even had that option. Although I don't know if I would have taken it at that time because
Mhm,
back in my undergrad, I never thought I'd be an entrepreneur. I thought I hate sales, I hate marketing, I just want to train people. So I don't know
mhm,
if I would have taken that course. But looking back at it now, I would have at least liked to have the option.
right.
Uh, Now, fun questions. What do you guys do in your free time?
Go ahead.
Okay, I'll start first. I play a Chinese instrument called pipa, P-I-P-A,
Yeah.
and it is a traditional Chinese instrument. And I help with the Toronto Chinese Orchestra from time to time to help them with certain concerts, their annual concerts, and their Christmas concerts as well. And then recently, I think upcoming in May, I have we work with a Canadian opera company
Yeah.
and their youth division because by a very talented composer, Alice Ho, she composed a Chinese opera version of the Monkey is King, the Monkey King legend in China, and they did a whole opera about it. So we utilized the Canadian Opera Company's children's choir to sing the story to a wider audience. So this has been nominated for Juno and has been nominated for multiple things. We've done recordings, and it's been a wonderful journey to be able to like kind of like experience that with them. And yeah, music wise, I think that's my passion. My other foot is in it, while my foot is in naturopathic medicine and clinic
Yeah,
cleaning.
yeah.
So yeah,
Gives you a nice outlet for other things.
very different, very different.
What is pipa? Is it a wind instrument, string, something else?
It's a lute, so it's kind of like a guitar, but you play it upright. So we have four strings, and it's all pentatonic.
Okay. I used to play the trumpet, but I don't know what pentatonic means.
Pentatonic means as in like it uses five syllables, do, re, mi, so, la. So it doesn't have the F and the B in most like the seven tones.
Yeah, yeah, that helps. I used to play the trumpet, but I haven't played it in a very long time and I really miss it. So yeah, great to have an outlet like that. And David, what are you doing for free time?
I don't play the musical instrument. I did pick it up a guitar when I was much younger, so I didn't play that. But what I do like to do, with the limited time that I have outside of running the business is I like to play badminton. It is a huge passion of mine growing up. It's a sport that I really like, and overall, it's really great. And it's one of those sports that you can play when you're young. You can also play when you're older, and it kind of welcomes people and from various ages and various skill sets as well too. So
Yeah.
for me, that's what I like to do when I can.
You ever try pickleball?
I want to try that as well. It's on my list. Some of the badminton courts that we go to actually are converted into pickleball courts as well too.
Yeah, I've been playing tennis for the last like 4 or 5 years. I mean, I played tennis as a kid, but
Hmm.
then I picked it up again about 4 or 5 years ago, and I love tennis. But people keep telling me I should try pickleball. I've never tried it, so
Hmm.
I'm a little curious.
Yeah, it'll be. I think it'll be something that'll be fun. We should try this out.
Okay, I'm down. I'm down. And second last question, since this is after all a Best of Markham podcast, what is your favorite business in Markham besides your own?
I will start. So yeah, this is a tough question to be honest, because Markham has so many really wonderful businesses and it's all around us. I would say that I'm very impressed. Like we're talking about business, right? So when we're talking about business and how the business actually works,
Yeah,
I'm actually very impressed by all the dentists. Like nothing specific, but I find that the dentistry business is so well thought out that it is a well-oiled machine, and their profit margin and the way that they utilize the doctors versus the hygienists and stuff like that, it is always an inspiration for healthy to-dos as well as myself to kind of go like, how do I make it a little bit more well-oiled? How do I improve my business? I have tons of dentistry friends, and I sometimes pick their brain. I'm like, and they're taught this. They're taught business in
yeah,
school. And I'm always impressed by how many blueprints of business owning and marketing and all that type of things that dentist has, like all the resources that they have compared to my industry as a naturopath or even chiro or personal trainer. It's a wealth of information. I still steal ideas from them all the time in order to improve my own business. So I'm always very in awe of that business model. Anyways, it's not one business particular, but I think from a business perspective, I really love it.
yeah. Is there a specific like dentist in Markham that you can recommend?
Um, I don't I don't go to a dentist in Markham. I go to a dentist in Stouffville, actually.
Yeah.
Close enough, I suppose. But yeah, so
Okay.
small work in Stouffville. Yeah.
Is there a specific like one business whether it's one dentist, chiropractor, restaurant, lawyer, accountant in Markham that you can say that's a very good business?
I'm gonna leave that to Dr. Dave.
Okay.
It's also hard for us to say too. It's because we attend a local chamber of commerce, right? And we what we see is we immerse ourselves in small business owning, right? So we get to see what everybody is looking to build. So when we have these conversations and we build these connections with everybody, we get to see how passionate everybody is in each of their sectors. And as a result, it just kind of ignites a little bit of passion in our sector and for us as well too. We get to see where everything is being created, right? What's being happened in all the different industries. And for us, it really is inspiring to see what's been working in certain industries and you see commonalities that are related in fields that don't have connection whatsoever, right? So at the end of the day, we are entrepreneurs, right? Everybody that attend these chambers of commerce, we're all entrepreneurs, and that's what the commonality is, regardless of whatever sectors we're in, right?
Yeah.
Um, I would say the sectors that I have a little bit more interest towards is similar to what Dr. Wendy is. It's dentistry and actually med spas because that is something that has a lot of relationship to what we do in privatized healthcare, right? A lot of their marketing, a lot of their what they do to create websites and what to make a service that's desirable in terms of marketing. That's something that I've always found really fascinating, especially with just learning about their strategy and their business outlook aspect of it. So I
Sure.
would say rather than a unique individual clinic or business, it's more of like a sector that I'm looking at, and it's more of that privatized healthcare model that interests me the most.
Gotcha. Yeah, yeah, yeah. I mean, it's interesting to learn from other entrepreneurs. But forgetting that for a second that you guys are entrepreneurs, as a
Mhm,
consumer, what business do you like to visit or to frequent, whether it's a
mhm,
one-time thing or a multi-time thing, like a restaurant might be a multi-time thing,
mhm.
obviously a multi-time thing, but something that's just a one-time thing.
Sorry, we might have lost him a little bit there. But for me, I do like a lot of coffee shops, so I do like to walk around different places. We haven't really gotten too much opportunity to explore Markham. We did start our business about a year and a half ago, so we're still kind of looking at different shops here and there. Occasionally, we would just pop by and go and have our meetings at various coffee shops and closer around the Main Street Unionville area, which is close to our place.
Yeah. So is there a specific coffee shop you particularly like?
Right now, I can't think of any at the top of my head right now. There are a lot of wonderful ones there. I'm just blanking on a name right now.
Okay, okay, no problem.
Tough, yeah.
And lastly, how can our viewers and listeners get in touch with you guys?
Yeah, so Instagram would be something that we collectively check as a clinic. So at HealthyToDos on Instagram, we do have individual handles for myself, which is Dr. David Tam, and also Dr. Wendy Zhou. She would have Instagram as well. You're also welcome to shoot our clinic a email at info@healthytodos.com.
Perfect.
I
Welcome.
I do like to add that one of the things that we were trying to do earlier, like Dr. Dave mentioned, that we are trying to create a lot more free DIY type of like information for our patients. It can be actually found at our Instagram a lot. Like we post on our Instagram of like pretty frequently. And if people are just trying to understand a condition or they're just trying to understand what to do, DIY at home, that type of small tips and stuff like that, our Instagram is actually a great resources for people to follow. Partially also because we post from all the type of like all the type of contents, right? We post public health, cancer, we post like osteoporosis, arthritis. So it's really a trusted resource, I would say, because right now there's a lot of information out on the website, and people don't even know if they can trust the information or not. If it's AI generated, or there's holes in it, or like if they're trusted, um, like profession and stuff like that. So all the contents are created by us. I would say that it's very trustworthy, and if people just want some good, trustworthy medical advice, or not really advice, sorry, medical information, our Instagram is a great way to kind of check it out.
Awesome. Thank you. And I'll link to it as well in the description to the show. Guys, thank you so much for being here. I really appreciate the chat, the business wisdom, and good luck in your businesses.
Thank
Thank
you
you
so
so
much.
much.
My
Thanks for
pleasure.
having us, Igor.
Thanks.